Dangerous link. Do cardiovascular disease and erectile dysfunction share a bidirectional relationship, where they can both predict and influence each other? To answer this question, I will simplify this complex relationship by creating a simple chart. Cardiovascular diseases increase the risk for later erectile dysfunction. On the other hand, erectile dysfunction appears to be an early warning sign of future cardiovascular events. To explain this bidirectional relationship between cardiovascular diseases and erectile dysfunction, I'll cover two key aspects in two parts. Part A explores the role of cardiovascular disease in causing erectile dysfunction. In contrast, Part B examines how erectile dysfunction itself acts as an independent predictor and frequently the earliest clinical manifestation of future cardiovascular events. Part A, the role of cardiovascular disease in causing erectile dysfunction can be evaluated by examining evidence from studies on frequency of sexual dysfunction in patients with established cardiovascular disease and the frequency of sexual dysfunction after acute cardiovascular events. Established cardiovascular disease refers to clinically diagnosed and confirmed conditions affecting the heart and blood vessels. For example, coronary heart disease, heart failure, and atherosclerosis. Acute cardiovascular events refer to sudden, serious, and often life-threatening medical emergencies caused by problems in the heart or blood vessels. For example, myocardial infarction, unstable angina, and atrial fibrillation. Study on frequency of erectile dysfunction in patients with established cardiovascular disease. Research showed that patients with cardiovascular diseases experience sexual dysfunction, including erectile dysfunction, more frequently than the general population. Study on sexual activity and cardiovascular disease. A scientific statement from the American Heart Association research reported that approximately 25% of patients with heart failure reported stopping sexual activity completely. 60 to 87% of patients with heart failure reported some level of sexual dysfunction, including a loss of interest in sexual activity. An umbrella review of 5 meta-analyses and 2 systematic reviews was conducted to evaluate the association between erectile dysfunction and cardiovascular disease. Study results showed a higher risk of cardiovascular disease like coronary heart disease, myocardial infarction in patients with erectile dysfunction than in other patients. Study on frequency of sexual dysfunction after acute cardiovascular events. Studies showed that sexual dysfunction after a myocardial infarction occurs in up to 3/4 of patients. All adults have less sexual activity and less satisfaction with sexual activity after a myocardial infarction. Decrease in or loss of sexual activity after myocardial infarction may occur more commonly in females than males. Sexual dysfunction can occur after coronary artery bypass graft surgery. Part B, erectile dysfunction acts as the earliest clinical manifestation of cardiovascular disease. Etiology of erectile dysfunction in patients with cardiovascular disease. Sexual dysfunction, including erectile dysfunction and atherosclerotic cardiovascular disease, shares many common risk factors and underlying pathological mechanisms. The dangerous link between erectile dysfunction and cardiovascular disease is largely due to these shared risk factors and underlying pathological mechanisms. These risk factors include cigarette smoking, obesity, metabolic syndrome, hypertension, diabetes. Reasons for sexual dysfunction in patients with cardiovascular disease. Both psychologic factors and physical factors contribute to sexual dysfunction in patients with cardiovascular disease. Psychologic factors include depression, anxiety, concerns about the safety of sexual activity. Physical causes of sexual dysfunction include medication side effects and presence of cardiovascular risk factors that affect sexual function. What studies say about psychological and physical factors contributing to sexual dysfunction in patients with cardiovascular disease? Several studies examine psychological factors contributing to sexual dysfunction in patients with cardiovascular disease. These studies revealed that patients and their partners are often afraid that sexual activity will trigger an myocardial infarction or sudden death. Depression and anxiety occur commonly in patients who have experienced an myocardial infarction. Myocardial infarction can trigger or exacerbate a lack of interest and sexual dysfunction. Studies on physical factors contributing to sexual dysfunction in patients with cardiovascular disease concluded that side effects of medication, like diuretics and beta blockers, can cause sexual dysfunction. The presence of cardiovascular risk factors such as hypertension, smoking, diabetes, and postmenopause affects sexual function. Thanks for watching. If you found this helpful, hit the like button and please subscribe to get future video lessons.